Hi, good morning, everyone. Thank you so much for coming. My name is Regan Bergmark. I am a rhinologist and endoscopic skull-base surgeon over at the Brigham and Dana-Farber Cancer Institute and did all of my training here from medical school, residency, fellowship, onward. And I'm also a grateful Mass Eye and Ear surgical patient with deep thanks to Dr. Randolph and Dr. Russell for my new patient credentials from 2023. I have the distinct pleasure of introducing my friend and colleague, Dr. Alessandra Colaianni. Dr. Colaianni is a head and neck surgeon at OHSU, soon to be UNC, an incredible writer and storyteller. She studied medicine at Johns Hopkins, followed by residency here at Mass Eye and Ear, and then fellowship at Vanderbilt. She was also a Gates Cambridge Scholar, earning an MPhil from the Department of History and Philosophy of Science at the University of Cambridge. She focuses on narrative medicine, creative nonfiction writing, and surgical ethics. Her writing has been featured everywhere you'd want to read it. Harper's Magazine, The New Yorker, The New York Times, The New England Journal, JAMA, and others. On the rare chances I've gotten to see her work in progress, it is truly thrilling. She also fits a lot into her life. She loves to hike, fish, and canoe with her partner, her daughter, and dog, and she will be speaking today on being a surgeon. Dr. Colaianni, thank you so much for joining us.
Thank you so much, and good morning. So distinguished faculty and guests, I thank you so much for the invitation to speak to you today. I'm really honored to be in this room addressing you and celebrating 200 years of the Massachusetts Eye and Ear. I only spent 5 years here, which seems sort of paltry compared to 200, but the more time passes, the more I appreciate just how potent and meaningful those years were. I'm grateful to look out into this room and to see so many of my mentors, colleagues, and role models, all of whom have had outsized impacts on my life and career. And it's even more poignant to realize that I'm also addressing some of my mentors' mentors. One of my favorite things about surgery is how much of a storytelling tradition it has. So much of what doesn't make it into textbooks survives in oral history form. When we spend so many hours in the operating room and clinics together, we often start to tell stories about how we learned a particular technique or how other people have learned from or approached a problem or about some outrageous thing that happened during a similar case. We end up passing on anecdotes that become legends, and as someone who appreciates the intrinsic value of storytelling, I love that this is part of surgery's legacy, and I treasure telling the stories from my residency here to my current residents. Residency is a kind of metamorphosis, which is why I've chosen this piece of artwork to accompany my remarks today. This painting is of a chrysalis under a bell jar, and it's by a graphic artist named Ashley Floriel. It was commissioned as cover art for The Nocturnist, which incidentally is a storytelling show for physicians and healthcare workers. And I thank The Nocturnist and Ashley for their permission in using this image today. Metamorphosis is tough. Transitions can be uncomfortable, even painful. They can be violent. They can leave you vulnerable in the process of shedding one skin and assuming another. Surgical training is a particularly grueling metamorphosis, and I've thought a lot about and written a lot about the process of becoming a surgeon, what it takes, what it means, and why we do it. Surgery is awesome, as in inspiring awe. I bet everybody in this room can remember their first time in an OR. I remember being on a 24-hour trauma call that one of the trauma attendings at my medical school had offered to first and second year medical students who wanted to get a feel for what it was like in the hospital. Not much was going on in the middle of the night in the hospital, so the attending I was with took me over to the operating rooms where there was a kidney transplant taking place. I remember standing perched on a step in the corner of the room, safely out of the way of the sterile field, but what little I could see was incredible. This intricate ballet between the surgeon, his fellow, and the scrub nurse, a team that had worked together so many times before that there seemed to be barely any need for talking. At one point, the attending I was shadowing tapped me on the shoulder. "Watch this," he said. As I watched, the surgeon finished the arterial anastomosis and released the clamps. The donor kidney pinked up as blood flow was restored, and I was spellbound. I was so carried away that I actually said, "Oh my goodness," in an extremely loud voice in a very quiet room. And the transplant surgeon didn't miss a beat. He looked over in my direction and said, "Well, I'll have what she's having." I laugh about how enthusiastic I was in my reaction, but part of me wants to shout, "Oh my goodness," every time I operate. There was something totally magical about what had just happened as these surgeons went about an ordinary, extraordinary day. Surgery is uniquely fulfilling. Operating weaves together the beauty of an anatomic dissection, the gracefulness and economy of movement, the cohesion of a team, and afterward, the gratification of having fixed something, a problem solved, an incision closed. When it's going well, the sensation is akin to what I imagine it feels like to fly. Surgery is an incredibly intimate enterprise. A human being trusts you to put them to sleep, cut them open, and rearrange them. There is no way for them to know or see what happens in the operating room. The trust that our patients necessarily place in us, sometimes after only meeting with us for a short while, is humbling, and it's part of what makes the work we do especially fulfilling. Surgery of the head and neck, the otolaryngologist's domain, requires a particularly astonishing level of trust. We live so much of our lives above the clavicles. Our senses of sight, hearing, tasting, smelling, our ability to speak and eat, our ability to recognize ourselves in the mirror, these are, I would argue, a large part of what make up our humanity. And these senses and functions are all a part of and at risk in our surgical field. But surgery is also a human enterprise, and this, to me, is the thing that makes it so uniquely challenging. Much as we hate to admit it, we are imperfect. No matter how clever we are, how careful we are, how prepared, how meticulous, we can make mistakes. We can have bad days, days where we just feel off, days that come with unwelcome intraoperative surprises, days that leave us questioning our own abilities. The consequences of our mistakes are terrible, tangible, and immediate. Becoming surgeons while accepting our own fallibility means knowing that patients will be harmed by our hands. For perfectionists who went into medicine because we wanted to help people, this central tension can be difficult to swallow. Storytelling can help us here too, to heal from some of the things we experience during our work. We bear witness to life's tragedies, comedies, complications, and ambiguities on a daily basis in the hospital, and sharing those experiences with one another helps us to remember them, to process them, to learn from them. Whether we're seeking advice about a particular patient's course or simply debriefing after a day that went according to plan, we who carry the weight of caring can derive benefit from telling our own stories. Reading or listening to the stories of others or telling our own stories can help us to take a breath, to recenter ourselves, to support one another. It's a way to slow this fast-paced profession down and tackle some of the odd or confusing or joyful or upsetting things that happen over the course of an ordinary day that, to be frank, we don't really get to think about in the moment. About how to survive and learn from the odd and wonderful and sometimes terrible days that as healthcare providers become our normal. To think humanely about the humans we are caring for. Surgical training has for me required learning to balance sometimes conflicting needs, to maintain distance in the operating room and to make time afterward to reflect on the emotional havoc that disease can wreak. I feel the sadness of my patients' stories, even and sometimes especially after appreciating the beauty of their anatomy or extolling a great case with multiple oh my goodness moments. I've learned to value both as critical aspects of the work, and the triumphant moments provide a kind of insulation against the days with terrible twists. I have learned that to keep doing this work, I must feel both the joy and the sadness fully. In retrospect, I realized that one of the most important things I learned here were not specific approaches to a particular pathology or whether to use silk or vicryl or which instrument to use for a fastidious dissection. What I learned from the people in this room was how to be a surgeon, how to shoulder that awesome and terrifying responsibility, how to commit to being there for my patients, not just while they're asleep on the table, but for years and years and years to come. How to sit with my patients in that liminal space between diagnosis and treatment. How to get back up off the mat on the bad days and keep striving to improve. How not to shoulder this responsibility alone. I'm so grateful to have had mentors like you all to learn from and to continue to learn from. I'm lucky to be able to reach out when I have questions or want to run a patient past you or simply want to tell a story. It will shock no one here who knows me that I want to end with a poem. This is one by Emily Dickinson that I came across this year. It was written around 1859 when Mass Eye and Ear was just 25 years old. And although it's quite short, I think it emphasizes the delicate balance that we surgeons grapple with on a daily basis. Surgeons must be very careful when they take the knife. Underneath their fine incisions stirs the culprit, life. Thank you for your careful instruction.